In this episode of Hope in the Pipeline, we will dive into the topic of pediatric and adult insomnia disorder and how volunteering to participate in a clinical research trial testing new medication for insomnia might be of benefit to you now and can be a big key to helping others by developing better treatments in the future. Hello, I'm Dr. Paul Wylie, neuropsychiatry and sleep medicine specialist, and the medical director of Preferred Research Partners. Insomnia disorder is characterized by three main problems. Number one, trouble falling asleep, defined as the inability to fall asleep beyond 20 to 30 minutes after turning the lights out and electronics off. Number two, trouble staying asleep, defined as frequent waking during the night after sleep onset has already occurred, or difficulty returning to sleep after waking up in the middle of the night. And number three, waking up too early in the morning, defined as waking up at least 30 minutes before the desired time and before the total sleep time for the night reaches 6.5 hours, usually with the inability to return to sleep after that. To be classified as chronic insomnia disorder versus just transient or short-term insomnia, the difficulty with sleeping must be present for at least 3 nights per week and present for at least 3 months, and there must be ample opportunity to sleep in an undisturbed manner. Also, the insomnia cannot be caused by other sleep disorders, such as sleep apnea or periodic limb movements or restless leg syndrome, or be caused by any medications or any types of medical illnesses such as depression or overwhelming anxiety. Now, when insomnia is severe enough and persists long enough, those affected by the insomnia can experience daytime sleepiness, fatigue, irritability, mood fluctuations, declining work or school performance, difficulty concentrating and memory lapses. Insomnia, when present chronically, can also cause excessive napping, spending more time in bed just attempting to sleep, and can result in someone being preoccupied with being unable to sleep. There can be decreased energy, anxiety, depression, or increased emotional reactivity. Insomnia can also cause a worsening of asthma, muscle pain, headaches, and gastrointestinal upset. And even worse, chronic insomnia also causes an increased risk for development of early cardio and cerebrovascular disease, as well as weight gain and metabolic diseases such as diabetes. Pediatric insomnia and adult insomnia disorder have pretty much the same diagnostic criteria, but much more care must be taken in kids to exclude the impact of their behavior as a cause of the insomnia. For example, depending on the age, bedtime oppositional behavior, sleeping with animals, a developmental history of cognitive problems, co-sleeping with other individuals, bedroom sharing, such as bunk beds with a sibling, or other factors in the bedroom environment must be carefully reviewed. I can remember when I was a 6 or 7-year-old boy and I started suddenly waking up paralyzed around 6 a.m. each morning, and it was horrible. And I told my mom about it and how scary it was and had no clue what was happening. And ultimately, we tracked down the cause to being my older brother who had come back home from college over the summer to showering in the bathroom next to my bedroom each morning before going to work, and that the shower noise was disturbing my dream sleep. So you never know what's going on in an environment might cause some problems with insomnia. A good clinician evaluating insomnia will also look for the presence of growing pains, teeth grinding, excessive caffeine use, energy drink use, excessive napping, late night phone, TV, and video game use, shift work, parental discord, substance use, and academic pressures, as well as screen for depression and anxiety. Parental limit settings should also be evaluated by the caregiver. Behavioral interventions for pediatric sleep problems, especially in young children, have been shown to produce clinically significant improvements. At the end of the last podcast, I mentioned a book on behavioral treatment of insomnia by Dr. Richard Ferber called Solving Your Child's Sleep Problems. There has been so much response to this treatment suggestion that I have decided to give away 3 of Dr. Ferber's books in a drawing. So to enter the drawing, send your name and phone number or email to this podcast via our website and include the words research yes, and we'll put you on our newsletter contact list for upcoming research studies, and we'll enter your information into the drawing for this book. Behavioral treatment of childhood insomnia is particularly important given the lack of data regarding use of pharmacological interventions for sleep difficulties in children. In fact, it's not only a lack of data, there currently are 0 FDA-approved medications for the treatment of insomnia in adolescents and teenagers. So I'm pleased to report that at Preferred Research Partners, we are currently privileged to serve as a site for Idorsia Pharmaceuticals to test the first sleeping medication seeking to gain FDA approval for use in adolescents and teens. The medication we are testing has already been FDA approved for use in adults, and we were a site for that clinical trial. And the data has shown it to be the first sleep medicine to ever actually improve daytime alertness and cognition in adults, including adults over the age of 65. Remarkably, when the medication is taken every single night for 3 months and even up to a year. The safety profile of this medication in adults is really pretty remarkable, and now we are hoping to demonstrate its effectiveness and safety in kids. So we are currently looking for individuals aged 10 years to 17 years who either have chronic insomnia or who think they might have a chronic insomnia problem to help further test the effectiveness and safety of this medication. This is a paid clinical trial, and participation in this research can include the additional benefit of our site staff making an initial formal diagnosis of chronic insomnia disorder. If you or a loved one or a friend knows someone who has or might have a non-behavioral insomnia problem and think that they might be interested in exploring the possibility of joining this clinical trial, please check out our website or direct them to it at preferredresearchpartners.com to learn more. And here's some breaking news. We now have another clinical trial for a brand new medication to treat adult insomnia that just started yesterday. And it is for ages 18 to age 65. This new trial is about 12 weeks long, and it involves the use of a medication that is specifically designed to treat some of the muscle tension and anxiety that often accompanies adult insomnia. So, if you're interested in participating, please reach out and contact us, and we'd love to have you as a participant and a partner in that clinical trial as well. As always, please like, rate, and review our podcast, which helps more people to find it and to learn from it. And if you know someone who you think might benefit from viewing this podcast episode, please share it with them. As always, thanks so much for listening to today's Hope in the Pipeline, and we'll see you again next time when I talk about treatment of menstrual migraines.